Please advise any procedures recommended to correct and restore my lower, mid, upper face, i.e. facelift and/or fillers. I have just had 1 syringe of Juvederm Ultra Plus, 1 syringe of Juvederm Ultra, and 1 syringe of Restylane Silk divided between my nasolabial folds, marionette lines, chin, and lips. Side note, the doctor put Juvederm directly in the corners of my mouth and fanned outwards, which seems to be giving me even more of a side jowl-looking appearance. A hard lump also developed in my upper inner lip that I've had to go back and have dissolved with Vitrace twice now.
Thank you for your question. You're asking a very broad question of what to do to help your upper, mid, and lower face, and you've described your experience recently having had Juvederm Ultra Plus, Juvederm Ultra 1 syringe, and Restylane Silk 1 syringe, and unfortunately developed a lump that needed to be dissolved with Vitrace. Well, I'm going to give you a little bit about my background. I'm a board-certified cosmetic surgeon. I am a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. I've written a book on facial rejuvenation, and I have certainly come to a lot of conclusions about the different options we have when it comes to rejuvenating the face. So to begin with the photos you submitted, it's clear that you have a relatively thin face. Now the question that you posed about whether or not you need a facelift, the only way to really answer that question is physical examination. It is generally a facelift I try to avoid when a patient has a relatively thinner face and they have minimal jowling. And this is somebody who's usually in their 40s, a woman who is fit and in their 40s. Very often they can do this and it may look better, but with the facelift you have a limit on how much you can pull. You don't want to take somebody who's in their 40s and do a lift and they look good naturally, and if someone looks at them and maybe sees an incisional scar or something, that they'll think, oh, well, they look good because of the facelift. You see, there are two basic issues, and I think clearly you understand them because you're getting fillers. There's volume loss and there's descent. And in terms of descent, when the descent is significant enough that volume correction is not going to be as effective, then lifting is indicated. Now in our practice we do something called the Y lift. Now the Y lift is a very interesting procedure in that it kind of straddles the benefits of a facelift with the benefits of injectables. Essentially, without surgery, the Y lift procedure is able to accomplish some structural volumizing in a way that is not done typically with the way fillers are placed in general by cosmetic surgeons, dermatologists, plastic surgeons. It is when you described that you had 3 syringes and each syringe was done with the intention of using a certain viscosity level, it's very, very well thought out. But what you are probably experiencing is that you're still frustrated by the lack of the integrity of the structure and for the outcome that you desire. In our practice, we have done a lot of similar things for patients where I would put a filler like Radius in the mandibular notch and then use a filler like Restylane in the submalar area. We also routinely use platelet-rich plasma to help stimulate skin quality and glow. But I think that what you might find of value is learning about this procedure called the Y lift. It's not an advertisement for the Y lift, but I think that there's the basis for the success of this procedure is that when you're in that middle zone, there is certainly a point of no return where you put fillers, and you put fillers in a certain way where you might actually start to weigh down the tissue. Where Y-lift really works very well is it is a strategic placement of these same fillers, Juvederm, Voluma, but in a deeper level and in a very specific way where the structure of the face is actually enhanced, and that structure creates very remarkable definition and in many ways can look like a facelift without the facelift. So yeah, I certainly understand and respect the frustration you have. This is something that many people like yourself has. And although this is one solution I'm suggesting to you, I think you have to also understand what are the most important aspects of your facial anatomy that you want to see improve. Everyone comes to the table with a different set of values, but I think that there is a certain consistent value that many people share, which is why I suggested exploring the Y-lift. So I hope that was helpful. I wish you the best of luck. And thank you for your question.